Hi, my name is Samantha Passos, and today my presentation is on mental health in global psychology. So the table of contents, we pretty much will be discussing what is mental health, universal conditions, culture-bound disorders, and treating mental illness cross-culturally. So mental health is an individual's state of mind in regards to their cognitive function and emotional well-being. Some mental health conditions are usually described as an impairment to an individual's state of mind. Culture-bound syndromes are psychological symptoms an individual feels due to the influence of cultural factors. So, universal conditions tend to shift a bit. Culture-bound symptoms highlight the cultural and societal factors that can affect one's psychological health. But on the other hand, universal conditions emphasizes the biological foundation in mental health disorders. Some universal conditions found very cross-culturally is depression, one of the most commonly found psychological disorders in Western culture. Depression is about found in 1/5 of US rates when surveyed in China, so it tends to be less. And Nigeria had 4 times the rate compared to the US. Social anxiety is well documented around the world. It seems to be most prominent in cultures that emphasize fitting in. For an example is East Asia. Although East Asia scored higher in social anxiety, they see it as more of a normal thing rather than an abnormal thing. And suicide, it's most well defined and tracked around the world. Suicide is a cultural influence that differs the rate of suicides in different cultures. Most areas with religion that prohibit suicide tend to have lower rates, and Western territories have a greater amount of men that commit suicide compared to women. So these are some universal conditions that are usually felt through all the different cultures. Culture-bound disorders, there's a couple examples. One is a voodoo death, a condition most commonly known in Africa where people are convinced they have been cursed or broken a taboo. The fear can potentially lead to death. Another example is susto, a frightening experience that leads people to believe their soul has left their body. Latin America normally experiences susto, which can lead to physical and psychological symptoms. Phrygophobia, it's a morbid fear of being sick, normally found in China. The anxiety leads to people wearing masks, scarves, coats at any time of the year to prevent a cold. And coro, a condition most common in South and East Asia, where men develop morbid anxiety and fear that their penis is retracting into their body. And majority of all of these can just bring on a lot of anxiety, but they're very specific to the different cultures that they usually come from. Treating mental illness cross-culturally, while Western culture normally consists of individuals seeking out professional help through the use of psychotherapy. On the other hand, East Asian and Asian Americans are less likely to seek help due to the pressure of how others will perceive them. In Africa, Asia, South America, the Middle East, and the Caribbean, they normally use their family as a means of support and therapy. Another healing model commonly used between cultures is the focus on spiritualism and religion. And these are the references for today's PowerPoint and the end.